Hi everyone, my name is Erica Young. I am a graduate student in EKU's Psychiatric Mental Health Nurse Practitioner program. In this video, I am proposing a clinical practice change that incorporates health literacy as an intervention to help improve medication compliance among patients treated for chronic illnesses. Medication noncompliance is a global epidemic affecting healthcare providers and patients alike. The CDC reports only 50% of patients take their medications as prescribed. Although there are multiple modalities to treat health conditions, psychopharmacologic therapies happen to be a major component to treating and managing many chronic health issues. Because of medication non-adherence, health disorders are difficult to treat. This often leads to symptom burden, frequent hospitalizations, increased healthcare costs, and poor patient outcomes. Literature shows that patients who have a higher level of health literacy compared to those who have a lack of health literacy are more adherent to their treatment regimen and have better outcomes. The theoretical framework this proposal is founded on is a theory of self-care of chronic illness. This theory was chosen because the ability for patients to perform self-care behaviors is necessary to optimize their health outcomes without the assistance of a provider. The theory focuses on patients engaging in health promoting behaviors that lend to efficient management of chronic illnesses by using the knowledge and resources provided them. A few concepts explored are self-care maintenance, and these are behaviors individuals engage in that improve their health and well-being. Self-care monitoring, which involves individuals being able to observe and discern changes within their bodies. And self-care management, which involves individuals being autonomous and accountable for their own health. Application of the theory of self-care of chronic illness in advanced nursing practice will help ensure patients have the understanding and the autonomy to carry out all necessary health-promoting behaviors to achieve the best possible outcomes. During the implementation planning phase, there will be a recruitment of stakeholders, including pharmacists, clinical nurses, clinical manager, and patient support persons. Recruitment of the subjects, which they will have to meet the inclusion criteria, which includes being English speaking, 18 years or older, have at least one diagnosis of a chronic health condition for which they are taking at least one medication for. A budget will be discussed because it's necessary to cover resources such as health literacy assessment tools, handouts, which pertain to patients' health conditions and their prescription medications, and meeting spaces. Also, we'll be assigning responsibilities to our stakeholders. The pharmacist will be briefed on how to gather information pertaining to patient prescription refills and document any health literacy teachings they may provide the patients. The clinical nurse will be charged with gathering data from patient medical records on patients who have been hospitalized or triaged for exacerbation of symptoms as a result of medication noncompliance, and make weekly phone calls to survey patients about their medication regimen. The clinical manager will be overseeing the pharmacist and the nurse and act as a liaison. Patient support persons will be surveyed related to their loved one's medication regimen as well, and that'll be done on a weekly basis. Patients will be offered the opportunity to participate in the study as long as they meet the inclusion criteria. We have some interventions that will be discussed during the implementation phase as well. One is the short assessment health literacy tool, which will be done in the English version. Basically, this short assessment health literacy tool contains 18 test items designed to assess an English-speaking adult's ability to read and understand common medical terms. This is just for to gather baseline data for the patient. It's very short, 2 to 3 minutes long, and a score between 0 and 14 suggests that the patient's level of health literacy is quite low. So we want to aim for a score greater than 14 on that. In addition, we'll have handouts that include information pertaining to the patient's diagnosis or diagnoses and their medications. And also, we'll discuss technology with the patient, such as patient portals, so they can have access to their medical records and their healthcare information at their fingertips to also help improve their health literacy. As we collaborate during this phase, we'll be collecting data, and that data will be discussed and documented. This will include patient hospitalization records, survey results from weekly patient follow-up phone calls, weekly feedback from patient support persons, and patient records from the pharmacy. So if you look over to our Gantt chart, we'll have an initial meeting with our staff and stakeholders to cover the purpose and the plan of the study, along with our meeting times and locations. This will be done initially before we even put the study into play. Next, we'll be meeting with our staff and stakeholders on a monthly basis, collecting data each time that we meet and discussing that. And we'll have an implementation of the intervention, a time to do that. So during each patient's follow-up visit, each patient's follow-up monthly visit, we'll be implementing those health literacy tools that was mentioned earlier and assessing for our patients' health literacy. And we'll be collecting the baseline data results as well from the short assessment health literacy assessment. During the recruitment of the subjects, that'll be done initially, and we'll be evaluating the interventions for the patients for the 6 months period that the study is being conducted. We'll do that at each intervention. Okay. So during our closing remarks, because chronic diseases are better treated and managed when patient medication regimens are closely followed, identifying barriers impeding medication adherence is a necessary approach in patient care to optimize patient outcomes. Screening patients for gaps in health literacy and implementing health literacy interventions to improve health literacy may be the missing piece to the puzzle that helps patients become more compliant with their medications. Literature findings support the idea that patients with higher health literacy are more compliant with their pharmacologic therapy. This conclusion has become the catalyst that has inspired this study in an effort of implementing an evidence-based clinical change in practice that will improve medication adherence among patients and ultimately decrease episodes of decompensation, hospitalization, and healthcare costs. I want to thank you all for your time. Have a great day.